Most patients with neurourological disorders require lifelong medical care. The objective of this review is to provide a summary of the 2024 updated O guidelines on neurourology. Recommendations were developed by the panel to prioritize clinically important care decisions. Disorders of the central and peripheral nervous system significantly increase the risk of functional disturbances in the lower urinary tract. 95% of individuals with a suprasacral spinal cord injury exhibit symptoms of detrusor overactivity and detrusor sphincter dyssynergia, and approximately 75% of multiple sclerosis patients develop lower urinary tract symptoms after disease progression. Diagnostic evaluation should include timing of diagnosis and treatment, thorough patient history with focus on urinary, sexual, and bowel symptoms, bladder diaries and assessment of quality of life. Suprapontine lesions, characterized by predominantly storage symptoms with detrusor overactivity and with normal post-void residual. Spinal, suprasacral lesion, present both storage and voiding symptoms, typically with an increased PVR urine volume, and a link to detrusor overactivity. Lastly, sacral, infrasacral lesions lead primarily to voiding symptoms with a raised PVR urine volume, and urodynamics reveal a hypocontractile or acontractile detrusor. Urodynamic testing is essential. Focus on flow rate, voided volume, micturition patterns, hesitancy, and post-void residual volume. The diagnostic value is significantly enhanced by integration of video urodynamics, which adds a visual dimension to dynamic assessment of the bladder and urethra. Non-invasive conservative treatment, assisted bladder emptying, Crede and Valsalva maneuvers and triggered reflex voiding. External appliances such as pads and condom catheters offer social continence solutions. Neurological rehabilitation via electrical stimulation, behavioral therapy, pelvic floor muscle training. There is no single best treatment for neurourological symptoms. Combinations such as catheterization and antimuscarinics are often used to protect the urinary tract and improve outcomes. Medications target either storage or voiding symptoms according to their mechanism of action. Various antimuscarinics and B3 adrenergic receptor agonists exist on the market as seen here. Cholinergic drugs that improve bladder contractility for detrusor underactivity are rarely used. Minimally invasive treatment, intermittent catheterization, intravesical drug treatment such as oxybutynin hydrochloride, botulinum toxin injections, bladder neck denervation and urethral procedures including sphincter injections of botulinum toxin A. A sphincterotomy is discouraged due to incontinence risk. Urethral slings, particularly for self-catheterizing women, provide lasting benefits. In patients with neurogenic dysfunction and bladder augmentation, autologous slings are favored. Additional continence surgery such as artificial urinary sphincters are durable and successful, particularly in men with neurogenic stress urinary incontinence. Furthermore, sacral neuromodulation is effective and safe for the treatment of neurogenic lower urinary tract dysfunction in selected neurourological patients. Bladder augmentation aimed to enhance compliance has been shown to improve long-term renal function and quality of life. However, lifelong follow-up are required. Finally, urinary diversion protects renal function when other treatments are ineffective, with improved quality of life in many patients who have failed non-invasive and invasive procedures. Recommendations for sexual dysfunction in neurogenic patients includes use of phosphodiesterase type 5 inhibitors as the first-line treatment for neurogenic erectile dysfunction, followed by intracavernous injections and mechanical devices. Limited therapeutic options exist for female sexual dysfunction. However, most address lubrication issues and stimulation of erogenous zones above the lesions. Recommendations and their strength rating can be seen here. Neurological disorders very often cause lower urinary tract symptoms, sexual, and bowel dysfunction, which require a detailed diagnosis and follow-up for tailored therapy that takes the patient's health, lifestyle, and expectations into consideration. 2024 update of the O guidelines on neurourology provides an up-to-date overview of evidence from the literature on diagnosis, treatment, and follow-up for patients with neurourological conditions. More detail about these guidelines can be accessed on European Urology.com.